I've done about 3,000 cases using the HemaClear tourniquet. It's worked quite well, very, very effective in terms of giving me a bloodless surgical field. I've not had a single complication with it, and I've used it for both primary and revision knee replacement. We try and keep our tourniquet times under 2 hours. If we do go over 2 hours, of course, it's very easy. We just cut the HemaClear and then apply another HemaClear. It gets rid of a tremendous amount of clutter in the operating room. You get rid of your tourniquet stand. There's already a lot of parts and equipment that have to be in the room for doing total joint replacement, and getting rid of all that clutter is very, very helpful. It is a sterile device. As you know, reusable tourniquets tend to get very dirty and messy, and I think if patients had any idea that we were applying those things over and over again to their groin area, they'd be appalled. So it certainly is a much cleaner way of doing things. You know, it's so simple to use. It really doesn't require a lot of prepping or knowledge on how to use the product. I've never had a single problem with it. I haven't had any nerve problems, wound problems, nothing. So, in fact, in many ways, it may be even superior to traditional tourniquets in terms of the pressure on the thigh, because normally with traditional tourniquets, or not normally but frequently, when we use a traditional tourniquet, we'll get bruising in the upper thigh area, where patients will complain of pain afterwards in that thigh region, and I almost never get that with the HemaClear. Normally, you know, when you use a traditional cuff, that you lose about 6 inches or 7 inches of leg, and if it's a heavy patient, maybe even a foot of leg, you know, trying to get a traditional tourniquet on there. And it's actually much easier to use this, because we just apply the standard drapes, and then when we apply this, we have more than adequate surgical field, even for complicated revisions.
Yeah.
It's clean, it's easy. Like I said, it gets rid of clutter. Anything that makes things simpler, the nurses like. All the things you want. Easy to use, works, and it's not too expensive.